Hello and welcome to Module 8. In this module, we are going to discuss all about common resources and agencies. This presentation is approximately 30 minutes long. In this module, we're going to explore the Long-Term Care Ombudsman Program's relationships with other agencies, including the Ohio Department of Health, Ohio Department of Mental Health and Addiction Services, the Ohio Attorney General's Office, Adult Protective Services, and Disability Rights Ohio. We will also dive into some resources that are available to consumers, including legal assistance, Medicare and Medicaid, and MyCare Ohio. For the learning objectives, by the end of this session, you'll be able to interact with others as an advocate, understand the relationship between the Ombudsman Program and its sponsoring agency, know when a consumer might need help from a legal services agency, and ask questions in the context of Medicare and Medicaid coverage of care. So for section 1, we're going to go over partnering agencies. Let's begin with the Ohio Department of Health. The Ohio Department of Health's mission is advancing the health and well-being of all Ohioans by transforming the state's public health system through unique partnerships and funding streams, addressing the community conditions and equities that lead to disparities in health outcomes, and implementing data-driven, evidence-based solutions. ODH has about 1,200 employees performing many functions, such as environmental health, maternal and child health, and overseeing local health departments. ODH is organized according to their core public health responsibilities, but we as Ombudsmen only interact with a few of their divisions, one of those being the Bureau of Certification and Survey. This bureau is responsible for conducting on-site inspections or surveys of nursing homes, residential care facilities, some home health agencies, and others for compliance with state and federal regulations to ensure the quality of care and quality of life for the residents there. The Bureau of Regulatory Operations. This bureau is responsible for enforcing state licensing laws and rules and federal certification requirements for the participation in Medicare and Medicaid programs. Surveyors cite facilities, then the Bureau decides on the enforcement action. And finally, the ODH Office of General Counsel. This bureau is responsible for representing the Ohio Department of Health in legal matters. When a resident is appealing a discharge notice from a provider, ODH will schedule a hearing with the resident and the provider and a hearing officer. This hearing officer is an ODH contracted attorney. The Ohio Department of Health also tracks and retains a lot of data, including information about nursing home surveys. The Ohio Department of Health is one of the regulators for long-term care facilities. The Bureau of Survey and Certification is responsible for conducting on-site inspections of nursing homes and facilities for compliance with state and federal rules. Each nursing home in Ohio receives at least one unannounced inspection or survey during a 9 to 15-month inspection or survey cycle. During these surveys, all aspects of care and services are evaluated based on state and federal laws and rules. During the annual and complaint survey process, the Ombudsman can assist residents by giving the surveyor information about the home's verified complaints. Typically, you are not involved in this process, as you don't carry a caseload the same way a staff ombudsman does. However, you could interact with the surveyor when you happen to be in the home at the same time. If you encounter a surveyor, please contact the volunteer coordinator or a staff ombudsman. Investigation of a complaint in a nursing home is completed by surveyors after receiving the written documentation from the Ohio Department of Health Complaint Unit located in Columbus. There is a toll-free number and an online complaint form. The complainant may choose to be anonymous. As ombudsmen, we sometimes refer serious complaints that we can't resolve to ODH so that they can perform a complaint survey to determine whether a provider has violated a requirement. We refer only about 3% of our complaints to a regulatory agency each year. With most referrals, regional ombudsmen seek guidance from the state office to ensure the complaint referral is well written. A well-written, strong referral from the ombudsman can carry a lot of weight. After the survey process, if a nursing home is found to be out of compliance, they will receive a citation. These citations vary in scope and severity. The most serious type of citation is an immediate jeopardy citation, meaning that either one or multiple residents in the home are at serious risk of harm. Once cited, the provider has a period to come back into compliance. If they don't come back into compliance within the allotted period, usually 6 months, except in more serious and widespread deficiencies, they're at risk of losing Medicare and Medicaid payment, which could lead to closure. The Bureau of Regulatory Operations enforces state licensing laws and rules and federal certification requirements for the participation in Medicare and Medicaid programs. The purpose is to protect the quality of care and quality of life of residents, and to assure prompt corrective action when facilities are not in compliance with regulatory requirements through imposition of remedies, such as civil monetary penalties, denial of payment, state monitoring, directed in-service training, termination of provider agreements, and/or license revocation. Lastly, the ODH legal team provides hearing officers when a resident appeals a discharge notice. These hearing officers are attorneys that are contracted through ODH. The hearing officer acts as a third party who decides whether the discharge notice will be upheld or not. Hearings are typically held in a private but informal setting and include the resident, a provider, and a hearing officer. Ombudsmen can help a resident through the appeals process and attend the discharge hearing if the resident would like them to do so. The Ohio Department of Mental Health and Addiction Services, or MHAS, exists to provide statewide leadership of a mental health and addiction prevention, treatment, and recovery system. The mental health system in Ohio is comprised of county mental health boards, or ADAM boards, which stands for Alcohol, Drug, and Mental Health Boards. These boards connect consumers with alcohol, substance use disorder, and mental health services. MHAS also operates regional psychiatric hospitals in 6 locations across the state. These specialized facilities provide short-term intensive treatment to both patients, inpatient, and community-supported environments. They also deliver comprehensive care to patients committed by criminal courts. A few of their programs relevant to us include the licensure and regulation of residential facilities, Class 2. There are technically 3 classes of residential facilities, but we only have authority and provide services in Class 2 facilities, which we'll talk about more in a moment. The agency also operates a helpline, the Ohio Care Line, which is staffed by behavioral health professionals 7 days a week from 8 a.m. to 8 p.m. This line offers confidential support in times of personal crisis when individuals may be struggling to cope with current challenges in their lives. After 8 p.m., the Care Line will forward to the National Suicide Prevention Helpline. The Crisis Text Line is also available. This is a free, confidential service available 24/7 via text on mobile devices. Throughout Ohio, anyone can text the keyword for HOPE to 741-741 to be connected to a trained crisis counselor. Families and consumers can both use these services in times of crisis and when they're feeling isolated. As I just mentioned, the Ohio Department of Mental Health and Addiction Services regulates residential facilities Class 2, or RF2s. We often call these adult group homes, and use group homes and RF2s interchangeably. Ombudsman representatives advocate for those living in long-term care settings, and that does include group homes. These homes provide residents with accommodations, supervision, and personal care services, such as assistance with bathing. Some residents of group homes have mental illness and/or are receiving residential state supplement payments, which we'll also talk about in a minute. However, there are many people living in these facilities who do not have mental illness. Often these homes look like just another house in your neighborhood. Residential State Supplement, or RSS, is a program that provides financial assistance to adults with disabilities to help with pay for services in an eligible living arrangement. Individuals using RSS, which supplements their income to pay the monthly allowable fee or rent for living in the group home. The Bureau of Licensure and Certification reviews applications for new group homes to confirm that the owner has submitted all required documents. The Bureau of Licensure and Certification will contact owners to conduct an initial on-site inspection of the home that the owner proposes to use for residential care. Inspectors verify the safety and sanitary condition of the home. The Bureau of Licensure and Certification also interviews the proposed operator to confirm capability of the operator, and employees provide supervision and personal care services. They will check to make sure that the home is only providing care within its scope and that residents don't require a higher level of care. Owners are responsible for renewing their license annually. Ohio MHOS is responsible for investigating complaints made against group homes about things such as poor care and staffing issues. It has an online complaint form for consumers to use to submit issues with RF2s and mental health providers more generally. Ombudsmen investigate complaints in RF2s and make regular presence visits to these homes to check in on residents and remind them of their rights. Ombudsman may make referrals to Ohio MHOS in certain situations when the home's owner is not operating properly. As a volunteer, you will most likely not be asked to visit an RF2, but if you have a particular interest in visiting, let your volunteer coordinator know. Finally, MHOS is responsible for completing the PASS-R process, which is a screening process for nursing home admissions. PASS-R stands for Pre-Admission Screening and Resident Review. Sometimes people who do not need nursing home level of care end up living in nursing homes or consider moving to one. Some may need assistance that can be offered by a group home or other settings such as housing, meals, and assistance with other day-to-day activities, like scheduling appointments and transportation. PASS-R is a federally mandated process overseen by the state. The PASS-R assessment is completed before a person moves into a nursing home. It's an evaluation with questions designed to see if a person has a serious mental illness or a developmental disability to ensure a provider can address their needs and that those needs are being met in the least restrictive setting. Adult Protective Services help impaired adults age 60 and older who are in danger of harm, are unable to protect themselves, and may have no one to assist them. The Ohio Department of Job and Family Services, ODJFS, supervises the state's Adult Protective Services program. JFS plans and develops programs and writes rules and regulations pertaining to adult protective services. The County Department of Job and Family Services receive and investigate reports of abuse, neglect, and exploitation of vulnerable adults, and evaluate the need for protective services for individuals. County departments receive guidance from JFS. County departments of JFS are mandated to investigate and evaluate all reports of suspected abuse, neglect, and exploitation of vulnerable adults age 60 and over. Investigations of reports alleging abuse, neglect, and exploitation are mandated to be initiated within 24 hours if any emergency exists, or within 3 working days after the report is received by the County Department of Job and Family Services. Upon completion of the investigation, the County Department of Job and Family Services determine whether the adult who is the subject of the investigation, needs protective services. They do not investigate in nursing homes or residential care facilities. ODH and the Ombudsman Program do, however. Adult Protective Services will investigate in RF2s, as these are homes for adults living in a community setting. Social, medical, and mental health care professionals are mandated by law to immediately report suspected abuse, neglect, including self-neglect, or exploitation to the County Department of Job and Family Services. Other mandated reporters include attorneys, peace officers, senior service providers, coroners, clergymen, and professional counsels, among others. Ombudsman representatives are exempt from mandatory reporting requirements, and federal regulations do not allow us to be mandatory reporters. Any concerned citizen may report suspected situations of elder abuse, neglect, or exploitation to their County Department of Job and Family Services. An online portal is now available 24 hours a day to report suspected adult abuse, neglect, and exploitation. If someone is a mandated reporter, JFS encourages them to use this portal in non-emergency situations. As Adult Protective Services works in the community, we do not interact with them in our casework frequently. However, when ombudsmen are working with consumers who are receiving home and community-based services, if abuse or neglect is suspected, there is potential for overlap with APS. We sometimes get referrals from APS about complaints in long-term care facilities, and we will investigate those complaints. Ultimately, ODH is responsible for investigating and citing abuse in long-term care settings. And remember, ombudsmen may not make referrals to APS without getting appropriate consent to do so. Sometimes mandated reporters will report abuse to us that is occurring in the community. In that case, we need to let them know to report to Adult Protective Services, housed in the County of Job and Family Services. Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease or permanent kidney failure requiring dialysis or a transplant. The program helps with the cost of health care, but it does not cover all medical expenses or the cost of most long-term care. People have choices for how they get Medicare coverage, including through what is called traditional Medicare, or by signing up for a Medicare Advantage plan and Part D prescription drug plan. The same federal agency that funds the Ombudsman also funds states to operate an insurance information program. The Ohio Department of Insurance houses a program called the Ohio Senior Health Insurance Information Program. This program assists consumers in navigating the often confusing Medicare program and helps them in selecting the most appropriate plan for them. Consumers can call their hotline during normal business hours to get this assistance. This program also offers in-person counseling at a variety of locations statewide, especially during open enrollment, the period when Medicare beneficiaries can make changes to their plan, which is October 15th to December 7th yearly. Long-term care providers are responsible for helping residents with the application process for Medicare, but the Ohio Senior Health Insurance Information Program and the Ombudsman can assist. The Social Security Administration enrolls consumers in Original Medicare, both Part A and Part B. Medicare Part A, which is hospital insurance essentially, this helps pay for inpatient care in a hospital or limited time at a nursing home following a hospital stay. Part A also pays for some home health care and hospice care. Medicare Part B, or medical insurance, helps pay for services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Other parts of Medicare are run by private insurance companies that follow rules set by Medicare. Some residents who require a short-term stay in a nursing home for rehabilitation post-hospitalization use their Medicare coverage for at least some of the stay. There are requirements that must be met before Medicare will cover the stay, but when they are, Medicare covers up to 100 days of skilled nursing care per illness. Medicare covers up to 20 days in a skilled nursing home at a rate of 100%, and then another 80 days at a rate of 80%. This means that the resident is responsible for the remainder. At times, ombudsmen hear about residents being discharged right around the 20-day mark. This can be a time for advocacy on the part of the ombudsman. Ombudsmen also hear about residents who are being discharged because they aren't participating in therapy and are being told they're being cut, meaning their insurance is no longer paying for them to stay there. This is another important time for an ombudsman to help. If you hear of these issues, reach out to your staff ombudsman for assistance. The Ohio Department of Medicaid provides quality, accessible healthcare programs and services to Ohio families and individuals who are low income. With a network of approximately 130,000 active providers, ODM, or the Ohio Department of Medicaid, delivers healthcare coverage to more than 2.9 residents of Ohio daily. So who qualifies for coverage? A United States citizen in Ohio, or someone who meets Medicaid non-citizen requirements, individuals with low income, pregnant women, infants and children, older adults, and individuals with disabilities. To be eligible for coverage, a consumer must be a United States citizen or meet Medicaid citizenship requirements, have or get a Social Security number, be an Ohio resident, meet financial requirements. Even if someone is not sure if they qualify for coverage, they can still apply. Some residents may have a spouse still living in the community and have assets like a house or car. This resident may still qualify for Medicaid, but there may be higher eligibility threshold. Consumers can apply for Medicaid in 3 different ways. They can do it online, in person, or by mail, or by phone. If you're working with a resident who is having trouble affording care, they might be eligible for Medicaid. It is the provider's responsibility to help residents apply for benefits. You could connect them with a staff ombudsman if you suspect that the provider is not providing this assistance. Once a resident is on Medicaid, they will pay most of their income to the nursing home, but there may be some deductions. The universal one is the personal needs allowance. Most residents whose care is paid by Medicaid will have $50 per month for individual expenses such as toiletries and clothing. This is the resident's money to spend as they see fit. Some residents only receive $30 a month if their only source of income is SSI. Contact the staff ombudsman if you hear of issues with residents' PNA, personal needs allowance, including a provider not allowing access to it or not allowing a resident to spend it as they wish. MyCare Ohio is a special program for people who are eligible for both Medicaid and Medicare and operates in only 29 counties in Ohio. These consumers receive their insurance benefits and care coordination through a managed care plan and are assigned a care manager. Care managers should assist with the care of the MyCare Ohio consumer. The Attorney General's Office, or the AG's office, is responsible for investigating healthcare fraud and patient abuse and neglect in long-term care. This part of the AG's office is called the Medicaid Fraud Control Unit. When providers knowingly make false or misleading statements in association with claims for reimbursement of goods or services under the Medicaid program, they commit the criminal offense of Medicaid fraud. Examples of Medicaid fraud schemes include billing for products and services that were never delivered, billing for a more expensive product or service than was actually delivered, billing separately for services that should be billed together, billing twice for the same product or service, dispensing generic drugs and billing for brand name drugs, denying services to eligible recipients, or not providing the level of service medically necessary or required, and submission of false information on Medicaid cost reports. The law also prohibits Medicaid providers from charging copays and prohibits the payment of kickbacks or rebates in connection with the delivery of goods or services for which Medicaid reimbursement is sought. This unit also investigates allegations of abuse, neglect, and exploitation in care facilities. The Attorney General has statutory authority to investigate these crimes. Anyone can report by calling the Ohio Attorney General's Medicaid Fraud Control Unit at 614-466-0722. Just as a side note, volunteers should never initiate contact with the AG's office about abuse. Always contact your regional program about suspected abuse, neglect, or exploitation, and the staff ombudsman will investigate and make appropriate referrals. Occasionally, we refer consumers to seek the services of a licensed attorney as we cannot represent them in a legal matter. Ombudsmen should not give legal advice. Even if you happen to be an attorney, it is not within the scope of our role. We will, however, refer consumers to their local area agency on aging or legal aid organization if they need this assistance. A few examples of when we may refer residents to legal services are if they want to appeal a level of care assessment. If a consumer feels that their level of care assessment leaves them without appropriate services and supports, then legal aid can help them appeal. Another example might be if a resident's Medicaid services were stopped and they weren't given notice, or if they still need services. Legal aid can help them appeal such a change or decision by Medicaid. Legal services is one of the 3 funding priorities of the Older Americans Act. Priorities means that the federal government has said there are 3 things a state must do with Older Americans Act money. Each state is required to set a minimum amount of Older Americans Act money that must go toward providing legal services. This means that the total Older Americans Act money that an area agency on aging receives, the agency must set aside a minimum amount determined by the state to provide legal services to older adults. In Ohio, this amount is 5%. Here's how it works. The area agencies on aging are required to contract with an attorney or organization to provide legal services. Most programs contract with a local legal aid society. The legal aids use this funding to roll up into their overall legal services funding priorities. Some legal aid societies are listed here, but there are legal services located all over Ohio. 2 of them even sponsor 3 of our regional programs, like Region 1 in Cincinnati is sponsored by Pro Seniors, and Regions 3 and 4 in Lima and Toledo are sponsored by Able Law. Disability Rights Ohio is also related to legal services in that these consumer advocates often approach issues from a legal perspective. Disability Rights Ohio is a nonprofit organization with a mission to advocate for the human, civil, and legal rights of people with disabilities in Ohio. They engage in numerous types of advocacy, including systemic, individual, policy, and when necessary, through the legal system. Disability Rights Ohio, or DRO, establishes priorities or areas of focus for their advocacy for each federal fiscal year. They are also funded by the Administration for Community Living, like the Ombudsman and the Ohio Senior Health Insurance Information Program. We are required to coordinate with them in some situations. There is a self-study assigned to this module regarding who the partnering agency is, just so that you can demonstrate that you understand how the Ombudsman interact with partnering agencies. For this exercise, you'll read a few scenarios, identify the agency that can assist and how they can assist. If you need assistance with this assignment, please reach out to your volunteer coordinator. Thanks for watching.